Good afternoon, everybody. It is January 29th, 2024. The time is 2 p.m. I'm going to give everybody just another minute or so to come online. Hopefully, everyone chooses to participate. The recording has started, but again, nobody's joined me, and I'm going to give everybody just a few more minutes to get started. If they don't join up, I'm going to get started, and of course, the lecture will be recorded and posted to Facebook. I'm sorry, posted to YouTube very soon this afternoon. Thank you. Okay, guys, let's just go ahead and get started. If anybody joins or tries to get in, I'll go ahead and admit them then. Again, today is January the 29th, 2024. Time now is 2:03 p.m. And we're going to be talking about chapters 5 and 6 in the textbook. The topics are anatomy and physiology and medical terminology. We had a great meeting this past Thursday. Everyone done great. Did a good job learning how to use cervical collars, backboards, KEDs, ambulance stretchers, and learn some of the basics of lifting and moving patients. That's important because almost every EMS response is going to involve lifting and moving a patient. I hope that everyone joins us this coming Thursday at the breaks at 12 noon. That's where we're going to do the skills for airway and ventilation. Those are important life-saving skills that you have to know, so it's very important that you be there. If you are one of these students who have not completed their online assignments, be sure to get that done because your grades are going to be based upon those online assignments. Also, your ability to sit for the test, the National Registry test, is based in part upon your scores on those online assignments. So be sure to get those done. Okay, I'm going to try to go in here and share my screen. And I'm just going to start with anatomy and physiology and open that slideshow or PowerPoint, however you want to call it. Give it just a second to pull up here on my computer. My poor computer is so old and overloaded that it has great difficulty running multiple tabs at one time, especially with a program that's as big as Teams. Let's see. It's trying to load, but I need to switch back over to Teams and get ready to share the contents of this. Okay, I hope everyone can see exactly what we're doing here. I'm just waiting for it to come up. And it's just taking a second to load up here. Okay. Okay, I'm going to assume that everyone can see this. Maybe not. Okay, I'm going to go ahead and assume that everyone can see this. I hope that you can. If there is a problem, remember everyone received an email with this slideshow on it. We'll start talking about anatomy and physiology. Now, anatomy and physiology are really two terms, two different ideas here. The term anatomy means the study of the structure of the body, where physiology means the structure or the study of the function or the working of the body, the study of the function or the working of the body. So, anatomy is what's there, and physiology is how it works. The human body is organized into different levels of being. Those organizational levels are cells, tissues, organs, organ systems, and finally organism. I'm going to go ahead and break that down here. Cells are the basic unit of life. A cell is the smallest portion of a living creature, and some living creatures are simply unicellular, means they have only one cell. If a organism has more than one cell and those related groups of cells group together, they form a tissue. If related tissues group together, they form organs. If related organs group together, they form organ systems, and multiple organ systems form organisms. So again, we started the cells, which are the basic unit of life. You have enough cells, they group together and form tissues. Related tissues are then grouped together, and those tissues form organs. When you have related organs, they form organ systems. And finally, an organism is a group of multiple organ systems working together. Gross anatomy. Let's talk about gross anatomy. That is the study of the body without the aid of or need for a microscope. In gross anatomy, the body is divided into various parts, regions, and areas. Examples of those portions of the body might include the head, the torso, or the extremities. The body can also be subdivided into smaller areas such as the chest cavity, the abdominal cavity, the thigh, the forearm, the cranial cavity. Heck, you might even divide it into an area and refer to that area as the hand. The musculoskeletal system supports and protects the body. It forms blood cells, stores minerals, produces heat, and allows for movement of the body. Those structures in the musculoskeletal system include bones, joints, muscles, tendons, and ligaments. We want to talk about bones. There's 206 classified bones. Those bones provide structure and support. The bone marrow manufactures blood, and bones protect internal structures. Give you an example of protecting internal structures. You got multiple bones up here. This collection of bones forms the skull. So who can tell me what the skull protects? I bet everybody knows that that is the brain. Also, the rib cage in the chest, that protects the heart and lungs. Kind of neat to know. The skeleton is broke up into the axial skeleton and the appendicular skeleton. The axial skeleton includes the skull, the spinal column, and the ribs. So the skull, the spinal column, and the ribs. I don't know. Should be in the, I don't know. The skull is formed of multiple bones, including the frontal bone, the occipital bone, the temporal bones, and the parietal bones. The frontal bone is here. The occipital bone is back in the back of the head. The temporal bones are on the side, and the parietal bones work closer up in here. The skull has orbital bones, and those are the bones that form the eye sockets. The hyoid, which is a bone inside of the neck at the base of the tongue. We have bones in our ears. We have the maxilla, which is the upper jaw bone. That's what your upper teeth are attached to. And the mandible, which is the lower jaw bone. We have vertebra, and vertebra make up the spinal column. Those vertebrae are stacked one on top of the other. There's a hollow space between or inside of each vertebra called the vertebral foramen, and that foramen is just a fancy word for hole. Most of those vertebrae have cushions between them called intravertebral discs. The spinal cord passes through the vertebral foramen, and the nerves exit the spine between the vertebrae. So, your spine is a group of flat bones called vertebrae, one on top of the other. There's a hole down through the middle of that whole column, and the spinal cord runs through the column. All the nerves exit the spine between the vertebrae. And to keep the different vertebrae from coming and pinching those nerves that exit between them, we have bushings or intervertebral discs to cushion the impact. Spinal column is divided into 5 sections. The cervical spine, which is in your neck essentially, you've got 7 vertebrae. The thoracic spine or thoracic spine has 12 vertebrae. And what's interesting is those 12 vertebrae are each fused to a pair of ribs. You have the lumbar spine, and the lumbar spine is simply the curved portion in your lower back. The sacral spine and the coccyx are each fused together. So the sacrum, or the sacral vertebra, there's 5 of them. They're fused together to form the sacrum. That is at the bottom of the curve of your back, basically at the top of your butt crack. The coccyx is the tailbone, and that's 4 vertebrae fused together to form the coccyx. It's very easy to break your tailbone. The cervical spine has 7 vertebrae. They're named C1 through C7. C1 is known as atlas, and atlas is attached to the bottom of the skull. C2 is known as axis. Axis is where the neck rotation and movement starts. So a C2 fracture, and if we all know what a fracture is, that's a broken bone. If you break C2, that's known as a hangman's fracture, and it's often fatal. Thoracic spine in the chest vertebra, there's 12 of them. Each vertebra is attached to the posterior end of a set of ribs, posterior being rear. The lumbar, the 5 vertebrae, the small of the back, common side of back injuries, not so much that you actually damage the vertebra, but you're damaging the intervertebral disc, the lumbar disc. We have the sacral spine, again, 5 vertebrae fused together, and they join the left and right hemipelvis, which is the wings of the pelvis on each side join the sacrum in the middle. The coccyx are 4 vertebrae. They're fused together, known as the tailbone. Easily broken. Fracture is painful. Okay, coming back up or north in the body again, the 12 pair of ribs attached to the thoracic vertebra in the back. They attach either to the sternum or the costal cartilage in the front. The sternum is the breastbone that runs right down the middle. You should have learned a little bit about that in CPR class. The ribs form a protective cage around the heart and lungs. Talk about the breastbone. The sternum, the manubrium, and the xiphoid process. The manubrium is a round, flat bone. It's located at the top of the sternum. This forms what's called the sternoclavicular articulation. We'll learn more about what clavicles are here in a minute, but clavicles are your collarbones. The sternum is directly underneath or below the manubrium. That's where you place the heels of your hands when you're doing CPR. And at the bottom end of the sternum, or the inferior end, if you're keeping up with medical terminology, you've got a little triangular bone called the xiphoid process. You should have also learned a little bit about the xiphoid process in CPR. If we press on the xiphoid, you could potentially break it off. Look at the pelvis. So we've got a left and right hemipelvis. Got parts called the ilium, the ischium. The pelvis is sometimes mistakenly called the hip bone. Okay. Here is the iliac crest. So this wing on each side is called the ilium. The ischium is the bottom portion of the pelvis. There's one on each side. Now, oftentimes you see somebody sits in your lap and you say, hey, you've got a sharp tailbone. You're actually feeling the ischium, not so much the tailbone or coccyx. You see the coccyx in the lower end, right below the sacrum. The acetabulum is the socket of the hip joint, even though the pelvis is not a hip bone. Any fracture of the pelvis can cause very severe bleeding. Just remember that. The femur, that's the big thigh bone. One of the strongest bones in your body, probably the largest bone in your body. The head of the femur inserts into the acetabulum to form a hip joint. Remember the acetabulum back here? There's a large blood supply due to the bone marrow located within the femur. Believe it or not, bones have their own blood supply because if you don't have blood vessels running in and out of the bone, the blood that's produced within the bone marrow can't go out and be utilized by the rest of the body. So a fracture to the femur can cause severe bleeding and this fancy word exsanguination, which means to bleed out, bleed to death. The knee and lower leg, let's talk about the patella, which is the kneecap, the tibia, which is the shin bone, and the fibula, which is located behind and lateral to the tibia. So it's located behind and lateral. Lateral means to the side. How do I keep tibia and fibula separated? I had trouble for a long time, but I remember T. Tibia is the shin bone. T is for top. So if someone was lying on their back, the bone on top there would be the shin bone or the tibia, and the fibula lies below the tibia. The tibia is not really a weight-bearing bone. Things you might want to study about the foot and ankle. We have tarsals, which are ankle bones. Metatarsals are foot bones. Phalanges are toe bones. You'll see this pattern repeat again when we deal with hands. So tarsals are ankle bones. Metatarsals are foot bones. Phalanges are toe bones. The calcaneus is the heel bone. And then you've got the lateral and medial malleolus. Watch my pronunciation on that. Lateral means to the outside, medial means to the inside. So the lateral malleolus is the knot on the outside of the ankle, whereas the medial malleolus is the knot on the inside of the ankle. We have the shoulder girdle. These are portions of the skeleton as well. The shoulder girdle includes the scapula, which is the shoulder blade, and everybody's felt their shoulder blades on their back. The clavicles, you've got two clavicles, those are your collarbones. The scapula and the clavicle articulate, which means they join together at the acromion process. The acromion process is right up here at the top of your shoulder. We've also got the manubrium, and the location of the manubrium, or the manubrium is the location of the sternoclavicular articulation, which means the sternum and the clavicles or collarbones joined together at that point. The upper extremity includes the bones such as the humerus, which is the upper arm bone. Some people call it the funny bone. It's not too funny when you hit your funny bone. We've got the radius. The radius is the lower part of your arm. The radius is located on the wrist side, whereas the ulna is located on the little finger side of the lower arm. The hand and wrist. We have carpals, metacarpals, and phalanges. Carpals are wrist bones, metacarpals are hand bones, and phalanges are finger bones. Now, we're not going to name each one of these. However, you need to know the general groupings. Again, carpals being wrist bones, whereas tarsals are ankle bones. Metacarpals are hand bones, phalanges, finger bones. We have different types of muscles in the musculoskeletal system, including striated, non-striated, and cardiac muscle. Striated muscle is also called skeletal muscle, and it's voluntary. That means you can move those muscles. You can consciously control them. Non-striated muscles are also called smooth muscles. They're involuntary. You cannot consciously control your non-striated muscles. Those muscles are found in the respiratory and digestive tract, as well as along the blood vessels. We have the cardiac muscle, which is known as the myocardium. It's got a neat property called automaticity. Automaticity means that the cardiac muscle automatically generates its own electricity. Different types of joints, ball and socket joints. An example of a ball and socket is shoulder and hip. A hinge joint, your elbow and your knee are hinge joints. And then we've got non-movable joints like the sacroiliac joint. That's where your sacrum joins your ilium down at the pelvis. We have tendons and ligaments that we need to know about within the musculoskeletal system. Tendons connect bones to muscles, and ligaments connect bones to bones. Try not to go real in depth on any of these right now because we're going to expand on them as we go through the different body systems and the emergency conditions related to those body systems. One of your more important body systems is the respiratory system. It's responsible for the intake of oxygen and the exhalation of waste gases. Respiratory system includes your airways, such as your trachea or windpipe, includes structures such as the lungs, and we know what the lungs are, the ribs, which are the bones that surround the chest, protecting the lungs, and the diaphragm is also part of the respiratory system. The diaphragm is a tissue membrane that is stretched across the lower border of the chest cavity, and movement of the diaphragm helps to regulate breathing. And we'll go into that more when we get into respiratory system. The cardiovascular system includes blood, and blood carries gases, nutrients, water, and waste products. We're all familiar with blood. Blood vessels, which are basically the pipes that carry the blood, and the heart is the pump that pushes the blood. So the primary components of the cardiovascular system: blood, blood vessels, and the heart. The lymphatic system. This used to be a mystery to me, but the lymphatic system is kind of like the body's storm drain. It collects all of those fluids that leak out and are floating around in your body. Now, if any of you guys have ever installed a French drain system, you've got the perforated pipe in a trench with gravel. That's kind of the way the lymphatic system works. The lymphatic system has these thin-walled vessels that absorb or take in the fluid that's located between the cells. If you could kind of visualize the gravel in that French drain ditch as being the cells, and the lymph vessels being the perforated pipe. We have lymph nodes located along the lymph vessels, and those are essentially filters more than anything. They capture, the lymphatic system captures and it returns free fluid that's escaped from the cells. It also collects pathogens, toxins, and cells that could harm the body, such as cancer cells. The lymph nodes filter the lymph or the fluid. Well, we said the lymphatic system will collect and capture things such as pathogens and toxins or cancer cells. So the lymph nodes are a location where you can see a lot of inflammation, or you can see cancers set up in those lymph nodes because they've captured those cancerous cells. Lymph nodes also manufacture lymphocytes, which help fight infection. We have the nervous system to talk about. The nervous system includes a central nervous system, the peripheral nervous system, and the autonomic nervous system. Central nervous system, or CNS, is basically made up of your brain and your spinal cord. In blue-collar terms, the brain is your body's computer, whereas the spinal cord is the wiring harness. The peripheral nervous system, or PNS, that's comprised of nerves that extend from the spinal cord. You remember, you've got the spinal cord is the big wiring harness. Well, you've got other wires that join in or other nerves that join in. Those nerves can either be sensory or motor nerves. Sensory nerves means the nerves are capable of feeling or sensing. And motor nerves are nerves that control what the body is doing. Kind of like a two-way radio. Autonomic nervous system, that's part of the peripheral nervous system, but it controls involuntary muscle movements, such as related to digestion, or blood vessels, or heart rate. The digestive system, probably my favorite system because I sure like to eat, it processes food for nutrition. Consists of the mouth, which includes the teeth and the tongue, the esophagus, which is the tube that food goes down when you swallow, the stomach, the small intestine, the large intestine, the rectum, and the anus. Now, where the large intestine and small intestine join together, you've got this little growth called the appendix. The appendix can become infected and inflamed from time to time. Let's go backwards and talk about some of these some more. You know, the teeth help to chew your food. The tongue helps to not only to talk, but it allows you to force food down into the back of your throat so you can swallow. The esophagus is the food tube. The stomach is where the digestion really happens. That's where the food is broken down by acids. The small intestine, then, the stomach empties into that small intestine. The small intestine is where nutrients are absorbed from what you've eaten and drank. The large intestine is where fluid or liquid is absorbed. The rectum stores feces or intestinal contents until it's time to have a bowel movement and expel them through the anus. There's some accessory organs in the digestive system: the liver, the gallbladder, the pancreas, common bile duct. The liver produces bile, and the gallbladder stores bile. The pancreas produces several digestive enzymes plus insulin. The bile and the pancreatic enzymes travel through the common bile duct and into the digestive system so that we can process our food better. It's more than just stomach acid that helps to digest food. The integumentary system. The integumentary system protects our body. It cushions from impact. It helps retain water. It keeps out excess water. It protects from infection. So your outer covering of skin and what's inside of the skin helps protect you from impact. It helps to keep you from drying out, keeps your water in, or keeps fluids inside of your body. It keeps out excess water. Otherwise, if you go outside in a rainstorm, you might become waterlogged. It also helps protect from infection by creating a barrier to pathogens or germs that enter your body. It keeps the parts of the body contained or keeps you inside. If you had a large enough rupture in the integumentary system, body parts can actually get squeezed out or fall out. The integumentary system also insulates you from outside elements. 3 layers of the skin. the epidermis, the dermis, and the subcutaneous layer. The epidermis is the outside surface of the skin that um, is not permeable or not very permeable. It's also not alive. The dermis is the living layer of the skin. Then we have the subcutaneous layer, which is the fatty tissue underneath the skin. The integumentary system also includes hair and nails. And our slides break down epidermis as the outermost layer. The dermis contains blood vessels, nerve endings, sweat glands, oil glands, hair follicles, and some smooth muscle. The subcutaneous layer has blood vessels, nerve endings, and fat tissue. Let's talk about the endocrine system. Take just a few minutes on that. Endocrine system includes glands that secrete chemicals called hormones. The pancreas is also an endocrine organ. It secretes this hormone called insulin. It helps you process blood sugar. The adrenal glands, which sit basically on top of your kidneys, produce hormones, epinephrine and norepinephrine. The thyroid produces a thyroid hormone, which basically helps your body stay in time and function at the right speed. The pituitary gland produces human growth hormone. So people who have a pituitary gland issue may produce too little or too much human growth hormone, then they would either be too big or too small. The renal system is also known as the urinary system. It filters chemicals from your blood. It helps excrete waste products out of your blood. It excretes excess water from the bloodstream and also helps regulate pH. And pH is how acidic or how alkaline your body happens to be at the time. Anatomy and physiology of the renal system. Kidneys are the primary organ. Kidneys filter blood, and when they filter blood, they produce urine. The ureters drain the urine down from the kidneys. The bladder stores the urine, and the urethra carries urine out of the body. Talk about some renal system conditions. Oftentimes, we see people who are in renal failure, which means the kidneys are failing, and those patients often end up on dialysis. Then we have a condition called renal calculi or kidney stones. So you have little calcium and other mineral deposits within the kidneys. Those aren't a big issue within themselves until they start down the ureters towards the bladder. And that's where those really rough mineral deposits, those little stones, scratch and cut at the inside of the ureters, produces severe pain and bleeding. Some people have urinary retention, which means you can't use the bathroom, you can't urinate. That can often be caused by medications, especially narcotic pain medications will cause urinary retention. Some people have functional urinary retention, which means that there is a problem with the actual function of the renal system itself or urinary system. Urinary tract infections are common, especially for females, and even more so common for elderly females. A female's urethra is very short as compared to a male's urethra, and that allows germs and pathogens to migrate north or up into the bladder. Foley catheters are a major cause of urinary tract infections. They produce almost like a super highway for these pathogens. The pathogens live on the surface of the Foley catheter, and now you see a lot of hospitals, nursing homes shying away from the use of Foley catheters. If anybody doesn't know what a Foley catheter is, that's a tube that's inserted through the urethra and into the bladder in order to drain urine. You're probably going to transport patients with some Foley catheters. Additionally, I want you to know that a Foley catheter has a balloon at the end of it. The catheter is inserted into the bladder, the balloon is blown up, and that keeps the catheter from just slipping back out of the bladder. Sometimes those get traumatically removed. Someone will pull that catheter out with the balloon still inflated. So if you could imagine having a balloon the size of a walnut pulled through your urethra, you could understand why that's painful and results in bleeding. Some patients have suprapubic catheters. The idea is the same, except the catheter is inserted through the skin instead of through the urethra. If you can imagine where a man's belt buckle is at, that is approximately the location where a suprapubic catheter would be inserted. The reproductive system. The reproductive system is a group of organs and glands for the purpose of reproduction. There's gender or sex-specific structures in both the male and the female reproductive system. The female reproductive system is going to be covered more in depth when we get into the obstetrics and gynecology portion of the class. The male reproductive system consists of structures such as the scrotum. The scrotum is the sac that holds the testicles. There is a spermatic duct which leaves the testicles, passes through the prostate. The prostate produces the bulk of the fluid portion of semen. You've got a Cowper's gland that produces a couple drops of fluid that helps to basically buffer the interior of the urethra so that the conditions inside the urethra do not kill the sperm that are within the semen. The urethra and the penis. The urethra runs inside the penis. Remember, the foreskin is sometimes removed from the penis in a procedure called a circumcision. If you've never had the opportunity to watch one of those, I would discourage you from doing it. Okay. That is the end of our anatomy and physiology slide. I'll stop sharing. And try to switch over here. Wrong button again, Albert. Okay, I'm going to go back to the slide presentation. I encourage you, if you have any questions and you're not live in the live lecture, that you be sure to let us know or let me know when that comes around on Thursday, and we'll discuss it then. Also, if you have any questions, you feel free to email me. And what would be really neat is if you'll send me an email, I will try to reply to that email and send it to everyone else that's in the class as well. I'll just courtesy copy everybody because you may have a question that someone just hasn't thought of yet. Okay. I'm going to share my screen again. Let me share this window. And we're going to take a few minutes to talk about medical terminology. Medical terminology is very important to know. Why do we need to know about medical terminology? Because that is the language in which medical professionals converse. Okay. By learning basic medical terminology, the EMT can better communicate with other health professionals. And you can read, understand, and participate in medical training if you know some basic medical terminology. The great thing about medical terminology is it's a work in progress. You do not have to know it all in the beginning. As you continue your journey into becoming an EMT, into becoming a EMS professional or other healthcare professional, you'll be able to utilize that medical terminology not only to learn from, but you can also expand on your medical terminology as you go. Now, there's the three sisters of medical terminology, as I like to refer to them. Medical terms are made up of three parts: root words, prefixes, and suffixes. Now, some medical terms may include multiple root words, prefixes, and suffixes, but if you have an idea what these terms mean, you'll be able to put them together and decipher the meaning of some of these medical terms. We got some basic root words. Let's look at the list. Broncho or pulmo relates to lung. Cardi refers to heart. Coli refers to bowel. Cyst is a bladder. Cyto refers to cell, derm to skin, gastro to stomach, gloss refers to tongue, hemo refers to blood, hepato refers to liver, ling refers to tongue, and myo refers to muscle. Some more. Look, NEUR refers to nerve. NAS, bone or nose or nasal. OST refers to bone. Pneumo refers to air and lungs. Uro refers to urine. Okay, so we've got some basic root words that we need to know. Now we have some medical prefixes. Prefixes mean they go in front of the root word. Ab means away from. Ad means toward or near. Anti is before. Bi is both or to. Brady is slow. Contra means against. Dis means painful or difficult. Hemi means half. Hyper means above or high. Hypo means below or low. Inter is between. Intra is within or inside. Peri is around. Poly is many. Post is after. We've heard of post-op. Just use that as a simple term. Post-op means after the operation or after the surgery. More prefixes. Pre means before. See, pre and prefix. Quad means four. If we've heard of quadriplegics in the past, those folks are unable to remove all four limbs. Sub means below or under. Super or supra means above or excess. Tachy means rapid or fast. Uni means one. So if we go back to tachycardia, you might put those words together. Tachy, the prefix, cardia being a root word. Tachycardia means the heart is beating rapidly, it's beating fast. Uni means one. So anybody that's got a unibrow, they've got one brow line. Here's some suffixes, and suffixes are related to the end of medical terms. Ac, pertaining to, al, pertaining to. Algia refers to pain. Emesis is vomiting. So let's do hematoemesis. That is vomiting blood. Ist, specialist. Itis is inflammation. So if we use the root word cardi and itis, carditis is an inflammation of the heart. Myocarditis is an inflammation of the heart muscle. Ology is the study of. So use cardi again. Cardiology is the study of the heart. Oma refers to cancer. If someone has an osteoma, osteo referring to bone, oma referring to cancer, they may have cancer of the bone. Osis is condition of. Plegia is paralysis. Remember quadriplegia? Paralysis of four limbs. Pnea means breathing. Rhea is a discharge. Spasm is a contraction. Now, I want you to be careful when you use these medical terms with non-medical people. Why do I want you to be careful? I want you to be careful not just in using them with non-medical people, but also medical people as well. When you use medical terminology with non-medical people, you might cause confusion. You might not get a really good medical history. You may not be able to obtain a really good medical history if you start using words that your patients and their family members don't understand. Now, on the upside, you might look very smart. This guy's smart. Look at all these big words that he's using. He's really smart. Here's the downside. When you're using medical terminology with other professionals, you may be able to communicate better, you may be able to learn more, but you also may seem really stupid if you don't know what you're talking about. Again, use those medical terminology, use that around lay people. You might appear really smart, but you use the words around people that know what they mean, you might not look so smart in the end. There's nothing wrong with using plain language when you discuss the body. And if you're a little unsure of your medical terminology, sometimes plain language is best. Let's talk about some anatomical and positional terms. Talk about anatomic position. Now, anatomic position is a standard reference position for the body in the study of anatomy. In this position, the body is standing erect, facing the observer, with the arms at the sides and the palms of the hands facing forward. So imagine someone is standing there, the feet are about shoulder width apart, the arms are down to the side, and the arms are rotated so that the palms face forward. You have to have a starting point when you start describing or relating one body part to another body part. Just like having a map with north, with the compass pointed north in order to have a starting point. Now, if you go back to geometry, a plane. In geometry, a plane is 3 points in space. It's a flat surface that goes on forever, and it's marked by 3 points in space. Well, a plane is a flat surface formed when slicing through a solid object. Let's talk about the term midline. Midline is an imaginary line that's drawn down the center of the body, dividing it into right and left halves. So if you could imagine a line, you're looking at the body in anatomical position. You start at the head and draw a line from the top of the head through the nose, through the chin, and all the way down into the groin to divide the body into left and right. Now that's midline. The term medial means towards the midline. So, which is more medial, your hand or your elbow? Well, your elbow is more medial because it's closer to the midline. The heart is medial within the chest because the opposite of medial is lateral. Lateral means on the side or away from the midline of the body. The heart is medial, the lungs are lateral, or technically correct, the lungs are bilateral because you've got them on both sides. So if someone breaks both of their femurs, they are said to have a bilateral femur fracture. Now, unilateral means it's limited to one side. Now, let's talk about the mid-axillary line. Imagine a line drawn vertically from the middle of the armpit to the ankle. That is the mid-axillary line. The anterior is the front part of the body, or what's in front of the mid-axillary line. The posterior is the back part of the body. Now, this can also relate to body part. It doesn't have to be the entire body. The anterior leg would be the front of your thigh, your knee, and your shin area, whereas the posterior of your leg would be the back of your thigh and your calf. Ventral is another term that refers to the front of the body. It's a synonym for anterior. Synonym means the same thing. Dorsal is a synonym for posterior. That's referring to the back of the body, the back of the hand, or the back of the foot. Now, think about back of your hand for just a minute. The back of your hand, we all know where the back of our hand is at. Remember, it faces the rear. That is your dorsal hand. It faces the rear when the body is in anatomic position. Superior means towards the head, and inferior means away from the head. These are usually compared with other structures. These are relative terms. The heart is superior to the stomach because the heart is closer to the head than the stomach is. The knee is inferior to the hip. The knee is below the hip. It's further away from the head than the hip is. Proximal means closer, and distal means further away. So whatever is closer to the torso is said to be proximal. Remember the word approximate. If a structure is distal, it's further away from the torso or more distant from the torso. So, which is more proximal, the wrist or the elbow? The elbow should be proximal to the wrist, and the wrist is distal to the elbow. Let's talk, what is the torso? The torso is the trunk of the body or the body without the head and extremities. Palmar is a term referring to the palm of the hand, where plantar is referring to the sole of the foot. Ever heard of someone saying they've got a plantar wart? Well, that's a wart on the sole of the foot. We've got some other terms and lines to learn about. How about the midclavicular line? Remember, we done the midline, which was down through the nose and groin, divided into left and right. We did the mid-axillary line, which is a line drawn from the center of the armpit down through the hip to the ankle. divides you in the front and back. Well, we've also got something called the midclavicular line. And those are vertical lines that are drawn through the center of each clavicle going down. Your nipples are essentially on your midclavicular line. Some other things to consider. How about abdominal quadrants? The abdomen can be divided into 4 quadrants. And those quadrants are upper right quadrant, or right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. When we do left and right, though, we have to remember we're talking about the patient's right or the patient's left, not your right or your left. Because when you look at someone, it's easy to point to what you say is the right arm when it's actually the left. So right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. It's important to know these quadrants, and it's important to know what organs are located in each quadrant so you can do a better assessment of someone with abdominal pain or abdominal injuries. So here we go. We look at the right upper quadrant, contains organs such as the liver, the gallbladder, the bile duct, part of the transverse colon, part of the ascending colon, part of the pancreas. But look at the left upper quadrant. It contains the stomach and the spleen, part of the intestines. Left upper quadrant also contains portions of the pancreas and the pancreatic duct. Right lower quadrant contains bowels and the appendix. The left lower quadrant contains a small intestine, portions of the rectum and anus. The meeting point or the center point is the belly button, the umbilicus. That's where the lines cross between right and left and upper and lower. Let's talk about some positions. And I know this is a lot of material to throw at everybody, but they're very important to know because you're going to have to be able to document how you found your patient, what position you placed your patient into after you found them, what position the patient was in when you transported them, and what position you left them in at the hospital. So some of those positions are prone. Notice the lady lying on her stomach. Opposite of prone is supine. The body is lying flat on its back. Right lateral recumbent and left lateral recumbent. These folks are laying on their left and right side. Fowler's position is that semi-seated position. In Trundelenburg, like when we demonstrated with the cot last Thursday, Trundelenburg is when the feet are higher than the head. So here we go. Anatomical and positional terms. That, my friends, is the end of the presentation. Okay, Dr. Phillips, I see you've joined us at some point, which is great. I'm glad to see that. Folks, Dr. Phillips is here on our Teams meeting. I'm kind of disappointed that you're the only one here, but I'm glad to see you're joining us. If you want to turn your mic on and share anything with the students, that would be great.
I just wanted to get logged on and monitor and see if you guys need anything.
Okay. I think I'm good as far as the instructor portion. if any of the students have anything, they do have access to your email because you were copied in all those emails sent out.
I'll be in the background for a little bit if they do need something.
Okay. That pretty well ends our remote lecture today. Unfortunately, it didn't take the entire 2 hours because there was no one here there was no one here at the time to ask any questions. I see we've got another one that's popped up here. Brett's popped up. How are you, Brett?
I'm good. How are you, Albert? Sorry I was late. My daughter's had to run her computer to Honaker. She had left it, so she had school today on a 2-hour delay. So I had to run it to Honaker.
Okay. Have you had the opportunity to look over the material?
Very little. I got
Okay.
had a busy weekend, and I'm gonna try to get some homework done today. But
Okay.
very little. I did look over some of the slides that you printed out or emailed yesterday.
Okay. That's great. That'll help. If you have any questions, be sure to share them with me.
Okay.
If you email them to me, I'll try to turn around and email a response, maybe to everybody, because you may have a question that someone just hasn't thought of yet.
Right. Okay.
Somehow I've turned my camera off, which is okay. I'll save everybody the
There you
pain
are.
of having to look at me here.
There you are.
Okay. What I am going to do though is I am going to cut the recording off.
Okay.
And I will save this recording and transcript, and I will post the recording to the YouTube channel this evening.
Yeah.
The previous recording. I'm sorry, I didn't hear Dr. Phillips.
Hey, Brad, this is Dr. Phillips. I just want to see if class is going okay and see if you need anything.
Oh, okay. Good to hear from you, Dr. Phillips. No, it's going good. I had to run to Russell County, so I just got back a few minutes ago and was able to get my computer turned on. But no, everything seems to be going good. I appreciate it, Dr. Phillips.
Hey, not a problem. One of the things the state wants is medical direction involvement, so I like to reach out to my classes and see if there's anything I can help along the way.
Okay, well, good. We appreciate you. Appreciate all you do for us.
Okay, guys, if that's it, unless somebody's got something to chime in, I'm going to go ahead and end the recording.